Hi, my name is Jazz Guy, and in this video I will be talking about motivational interviewing. We will look at what motivational interviewing is, how it works, and how it can be effectively applied to enhance exercise and healthy behaviours in clients. Motivational interviewing is a client-centred approach to behaviour change. At the heart of motivational interviewing, it is a collaborative partnership between therapist and participant. It draws on the notion that the client needs to be ready, willing, and able to participate, as they need to take an active role in their participation. The spirit of motivational interviewing is collaboration, evocation, and honouring the patient's autonomy. In collaboration, the client and therapist need to be partners in the process and both be active participants in the therapy. Evocation, the therapist looks at the patient's own motivation for change. The therapist helps connect the health change with the things the patient cares about. Honouring the client's autonomy, the therapist guides and advises, but ultimately it is up to the client to make the change. The client needs to be an active participant in the process, and there are a few things to check with the client before commencing in motivational interviewing. Firstly, the client needs to understand the importance of the change they are making, and they need to have the confidence that they can make the change. Finally, they also need to understand that the change they make is an immediate priority. Before engaging a client in motivational interviewing, please make sure they meet these guidelines. Within motivational interviewing, the therapist takes a non-confrontational role and should act more as a facilitator in the process, who is there to guide the client to their own conclusions and strategies for change. The therapist should be guided by the principle of rule. It can be natural as a therapist to want to jump straight into the solution and give the client the answers. However, in motivational interviewing, this will not lead to effective outcomes. Think along the lines of leading a horse to water but not making them drink. Rather than jump in with a solution, you must guide the client to their answer. We are all motivated by different things, and what might be motivating a therapist or practitioner to find solutions for a client is not always the best motivation or the motivation that the client has for themselves. While the benefits of exercise are clear, the client may be motivated by something more personal, such as wanting to set a good example for their children. And it's important for the practitioner to understand how to guide the participant, and understanding their motivation is at the heart of it. Effective listening skills are an important part of most therapy, but especially important in motivational interviewing, to listen with no judgment and an open mind so that you can listen to the client's own pros and cons about the change. A good rule of thumb is that equal amounts of time are spent talking and listening by the therapist. And finally, empower the patient. If they are actively participating, then they will have greater outcomes and better management for long-term and sustainable exercise habits. And this involves a client exploring their own ideas around how they can make the necessary changes, and are able to draw on their own knowledge about what has worked for them in the past and what has happened. And this allows the therapist to then guide them in the right direction. Next, let's talk about the basic skills for implementing rule and motivational interviewing, and this can be found with the acronym OARS. It's important for the therapist to ask open-ended questions, as this allows the therapist to engage the client. It also allows the client to do most of the talking and to offer up essential information. Affirmations can take the form of compliments or statements of appreciation, and it also helps to build rapport between the therapist and the client, which is essential for having a successful relationship. Using reflections can be used to amplify and/or reinforce the client's desire for change. They are also useful for the therapist to capture the implicit meaning and the feeling behind the client's statements. Paraphrase and sum up what you have discussed with the client. This can be extremely useful for the therapist to make sure they have understood the client correctly, and it allows the client to clarify anything that maybe was misunderstood. It also demonstrates that the client was actively listening and understanding the client's perspective. Now let's look at some real-world examples where motivational interviewing has been used effectively to increase exercise adherence. The first study we're going to look at is Ang and his colleagues, where they conducted a study and looked at the effect of exercise adherence on participants who had fibromyalgia. The subjects were randomized into two groups, one using motivational interviewing and one using another therapy as a control. A baseline outcome was then assessed prior and then at 12, 24 and 36 weeks. The study found that motivational interviewing actually encouraged participants to engage and maintain and initiate exercise, even when barriers like pain could provide an exercise technique. Another study by Nasstasia and her colleagues investigated the effects of motivational interviewing on youths that had been diagnosed with major depressive disorder. The study divided the participants into a control group and a group that would participate in motivational interviewing. The study found that motivational interviewing before exercise training actually promotes adherence to exercise. The other benefit that motivational interviewing had in this study was it actually prepared clients for exercise and increased the exercise readiness that they felt. So not only did it allow them to engage in exercise more regularly and consistently, but it made them feel more comfortable with actually engaging in the first place. There are, however, some barriers to implementing motivational interviewing in general practice, and these include the difficulty of professional development, as it can take a long time and skill in order to master motivational interviewing. The difficulty of practitioners adopting the spirit of motivational interviewing, as well as the patient's desire for a quick fix in their therapy. There are also barriers to the access of mental health providers, such as availability and cost. One thing that Ang and his colleagues found in his study is they conducted motivational interviewing via phone, which reduced the amount of travel time and reduced the inability to access the therapy. While motivational interviewing is a relatively new technique to use for exercise adherence, I've only cited 2 studies out of quite a few where it shows that it can be effective not only for exercise adherence but also promoting exercise preparedness and self-efficacy into creating an exercise routine. The studies also show that there are long-term benefits and can be beneficial to all age groups. So remember to follow the rules and use your oars. Thanks for watching.